Okay, welcome to another Zoom call. Got a bunch of questions that came in. Again, if you're new, most people chat their other questions in. So if you think of something, didn't have time to get something in, question in from the member site, just go ahead and chat that question right in. Remember, always go to the member site for information. We'll state what's new. You'll see what's new. We did have to raise our price. This is the first price raise we've had in, I said 12 years. I think it's actually been longer than that. Actually, 12 years ago, my price for cheek swab testing, kinesiology testing was higher than it is now. So we did have to raise the price simply because the cheek swab tests take me 30 to 60 minutes each to complete. And instead of charging, 150 per 15 minutes like we were doing, it's just $225 across the board. And same thing with our calls. So we had to do that with the increase of everything. Please, 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 when you send in a cheek swab, please send in the online request form. Or if you're not really good at online things, print it out and fill it out and send it in. But it'd be better for us if you did it online. So you sent in your information online. Also, if you personally added supplements and you're taking other things, that's just fine again. But I want to know what those are. So if you can email me a list or send in a list, PDF copy of a list would be best. Or you could email me a list at info or labs@huntersclinic.com. That would be good. Remember, some brands like Orthomolecular, they changed their policy. They don't allow online sales. Biotic Research doesn't allow online sales anymore. Crazy. I mean, it's like they're in the Stone Ages as far as how people buy things, but it is what it is. We can still carry them, we can still sell them, we just can't have them visible on the store. So if you need any of those things, call and just order. We also now added a subscription thing to our website, and you get a 5% discount on anything if you put it in a subscription. Also, if you're going to do a call with me, those are called educational coaching calls. Legally, they're not a telemedicine call. We have to state that and have you sign for that. So you have to do the coaching call request form. And that you're basically signing. This is not a telemedicine call. We have to just stay legal in everything that we do. Just be as diligent as possible in that. Remember also that everybody has full access to all the courses. One of the questions that I have down here is, do you have, not that question, is there audio available for all of our courses or our master classes? Yes, so now Dustin just changed that just a couple days ago. You can download the audio on on any of our courses, on the videos and things. You can the audio. I think there's a button somewhere on the course that you can underneath the information. Also look at our blog. There's almost 1,000 blog posts, so you can search for anything you're looking for if you're between Wednesdays or you want to find some information on something. Okay, first question. I will be getting a PET scan for the first time today and will follow it with high dose IV vitamin C plus 1,200 milligrams of glutathione. There's a later question about glutathione too. A recommendation I recently received to help remove the radiation. I've had the recurring thought that I should also do a coffee enema afterwards to support my liver, but I don't know what will help or will overwhelm my body. Let's talk about this first. The coffee enema is going to just support your liver detox pathway. So this is one of the best ways to detoxify, because remember, a coffee enema is going to stimulate your parasympathetics. It's going to thereby stimulate your immune system and thereby stimulate your detoxification pathways. So if some people can't tolerate coffee enemas very well, but if you can tolerate a coffee enema, it's the best way to help support your liver. Also, something that I would say is if you have access to a sauna, you want to help get rid of stuff out of your body when you're exposed to radiation, when you're exposed to dyes, when you're exposed to chemicals, when you're exposed to toxins. And if you could do a sauna, then you're just detoxing through your pores instead of through your liver. So you're taking burden off your liver. Drinking a lot of water can be very helpful too. So think of those kind of things. Go back to my 7 phases of detoxification course, using binders in the gut like charcoal and sodium alginate and humate and fumic acid and things like that can be also very helpful. Why would you use glutathione? So I know there's been controversy about glutathione in cancer. We've talked about this last week or the week before too. I used to be in the camp that I didn't want to use glutathione with cancer. I've changed my mind on that with some different research that has come out. Now I think glutathione is positive for cancer. What is glutathione? It's your main intracellular detoxification antioxidant. So what are oxidizing factors? Oxidizing factors damage cells, damage DNA, cause cancer, damage cell membranes. They're causes of cancer, oxidizing agents. Reactive oxygen species are causes of cancer. So, but the only caveat to that is chemotherapy is an oxidizing agent. Well, it's a poison. We're basically trying to poison your cancer cells. So if you were doing chemotherapy, then you wouldn't do glutathione. You wouldn't use alpha lipoic acid. You wouldn't use IV vitamin C while you're doing chemotherapy. Well, why? You need to protect your cells. Well, I know, but you are purposely trying to poison yourself with chemotherapy. And I don't mean that in a bad way. You are purposely trying to poison your cancer cells when you're using an oxidizing agent like chemotherapy. So don't negate, if you're choosing to do chemotherapy, well, then don't negate its ability by using a whole bunch of nutritional antioxidants because they work. And they will work by decreasing the ability for chemotherapy to kill cells, or at least wait 48 hours. So if you're doing IV vitamin C, if you're doing glutathione, if you're doing alpha lipoic acid, if you're doing vitamin C, if you're doing, higher dose curcumin, things that are antioxidants that are so good for you because they're antioxidants, you can't do them for at least the first 48 hours after receiving chemotherapy. But this person doesn't have a question about chemotherapy at all. They're talking about a PET scan and detoxifying the radiation and things. Well, glutathione is good to help with any detoxification, including radiation and such. So it is good. Now, I know there's some older information about glutathione, and well, glutathione can protect and help cancer cells. Well, then everything you're doing to stimulate, make your body healthy is doing that same thing too. So I kind of don't agree with that philosophy. So I do think that glutathione is beneficial for your cells. I mean, there's no doubt about it. And I do think that it is going to protect your healthy cells and protect your immune cells. So I think glutathione is a good thing to use. I also have a bottle of tocotrienol on hand. So what's tocotrienol? So remember, the vitamin E molecule found in nature has 4 outer shells. Those are called tocopherols. They're labeled alpha, beta, gamma, delta, tocopherol. Those are the 4 outer shells if you looked at it under a microscope. Then there's 4 inner molecules of the vitamin E grouping, and those are called tocotrienols. The tocotrienols are also alpha, beta, gamma, delta tocotrienol. So it has been shown that the delta tocotrienol is the most important for protecting cells, for protecting your arteries, for helping with your brain. Delta tocotrienol is essential. That's why I like so many of our private label products from Design for Health have a delta tocotrienol base. Delta tocotrienol is also a fat, so it's a great to use it as a base for supplements instead of having to use what we were talking about last week, the magnesium stearate or something like that that will help to keep the product from binding. So you're using a fat and you're using it in a fat soluble solution then. So the delta tocotrienol can be really good to help pull out radiation. Delta tocotrienol can help protect your cells. Delta tocotrienol is the key component for arterial disease. It can help relax your smooth muscles of your artery. It's really a great component. So how much do you take of that? I don't know the product that you have, but you literally can't take too much of it. So that's the key component of vitamin E. You hear about vitamin E is good for your heart. Well, only if you're using whole food vitamin E that has all the tocotrienols and the tocopherols. Really, if you were just using the delta tocotrienol, then it's good for your heart. If you're using the tocopherol, so much of the cheap supplements that you'd buy in the store would be vitamin E, and then you look at it, it says alpha or mixed tocopherols. Well, that is just completely worthless. It's good for your skin. Open up the capsule, spread it on your hands, but it's not going to be good for the rest of your body. It's not how you'd get vitamin E in nature. That's why cheap vitamins are cheap. I'm curious what you think of Ralph Moss's interview regarding soy. Do you still believe that soy is not beneficial for breast cancer patients? After hearing this, he says the weaker estrogen of soy plugs the hole in the breast cancer cell so that the stronger bodily produced estrogen cannot get into the breast cell. Just curious if the genistein from soy, that's an isoflavonoid of soy, will help lower my AFP, or do you still advise me against it? So I think what he was looking at with this is fermented soy, and he didn't state that in the interview, and I think that was an error. I do think that soy isoflavonoids are estrogen mimics, and they should be avoided for people with any breast cancer, even if you don't have ER positive, HER2 positive, or PR positive. Even if you're triple negative, I still think you should stay with soy. Now, again, fermented soy is completely different. Fermented soy actually removes the estrogen from the estrogen beta receptor. So it is the attachment of the bad estrogen on the estrogen beta receptor that blocks apoptosis. It's not about estrogen getting into the cell at all. So his statement about that is not correct physiology. I think he's a great guy. I've interviewed him on my podcast before, and but I don't think that's correct. My tumor markers continue to go up. My oncologist isn't real concerned yet about the tumor markers, but is concerned about the tumor coming to the surface. The tumor seems to be getting more painful around the tumor. I also have an additional lymph node that is popping up in the neck. He wants to raise my Ibrance to 100 milligrams if I'm okay with this. Also, he said that he is finding that letrozole is not killing the cancer like it used to, and rather moving on fulvestrant, which is a different drug. So I do agree that sometimes you have to switch up drugs. So I wouldn't be, I think that you have to refer to him about that. I think that would be, if I was in your situation, I would probably do that. Would I increase the Ibrance to 100? Possibly. The tumor marker is continuing to rise. My concern with that is the cancer decreasing? Now he thinks, well, that could be because the cancer is dying. That's because you went back on the Ibrance, and that could be very well true. Remember, that's why a lot of oncologists don't want to run tumor markers if you're on a chemotherapy, because your tumor markers can actually go up to begin with. And that can get scary, but he's still which I like to see this, he's making a more clinical judgment, not just completely based on a one test. I do not want to go on the shot if I don't have to because of the horrible hot flashes. Now, you got to remember, the horrible hot flashes are actually an indication that it's working. So we've talked about this multiple times on these Zoom calls. How do I get rid of the hot flashes if I'm on an estrogen reducing drug? Well, the idea is that if you're on an estrogen reducing drug and it's working, you're going to have hot flashes. And if you take something like soy flavonoids like genistein, you can help reduce the hot flashes, but it's conflicting because you are actually adding estrogen. Your whole idea is you're trying to get rid of estrogen, so why do the drug in the first place then? So that's why I disagree with this thing about Ralph Moss, is because you can take a person that's going through menopause and put them on a soy estrogen mimic of a genistein, and it will actually reduce their symptoms because it's estrogen-like, and it acts as estrogen. Well, it will also act as estrogen to the beta receptor of the estrogen beta receptor and cause issues with decreasing apoptosis. What are your thoughts on this about upping Ibrance for a month? I'm all for it. And see how everything is looking before changing everything at once. I'm all for that. And if he thinks that you're not responding to the letrozole going to this, I would refer to that. Another question: if I started the higher dose of Ibrance in 2 weeks to do the tumor markers, is that enough time to show change? I don't know. But a matter of fact, I said, if you're on, if you're on Ibrance, which, all the commercials say it's not a chemotherapy, but truly it really is. And actually your tumor markers can go up. It doesn't always, but they can spike. Again, that is really why so many standard oncologists don't want to run tumor markers, because they assume you're going to do what they tell you to do, which is do chemo, and your tumor markers can go up. And then they have to have a sit down with the patient and try to talk them off the cliff because they're all freaked out because their tumor markers went up and I did doing this chemo. So I get it. So, but if there's other signs that the cancer is growing, that's why he wants to do the increased dosage and consider that. What do you make of this success treating solid tumors by injecting them with polio? So here's a YouTube video. I didn't get a chance to watch it. But whenever you're adding something to the body to stimulate an immune response, that can help kill the cancer. This is why we've seen people get a really bad flu and actually put their cancer in remission. Their cancer went in remission after the flu. And it's not a coincidence because your immune system was so hyper-stimulated. This is the whole thing about, was it Epley's, what's the guy's name who used to inject toxins into people back in the 50s, and he was thrown into prison. He'd have a mix of different toxins and he'd inject it into people and their cancer would go away because it was enough toxins to cause this immune response. They'd get sick, they might have the flu, they might be throwing up, but it's not enough toxins to kill them like the standard flu. If you're, unless you're 85 years old, the standard flu is not going to kill you. But it's enough to stimulate an immune response. It's the whole idea of like bee sting therapy. It's the whole idea of mistletoe therapy. Same thing. Mistletoe is a human toxin. So you're putting a toxin in the body that's stimulating an immune response. And your body has to get rid of it. It fires this huge cytokine response. You fire this uptick in your immune system. That's how mistletoe therapy works. That's how bee sting therapy works. Of course, it just will never go mainstream because there's no money in it. Sad, but yeah. My oncologist is suggesting hormone blockers now that I refuse chemo because I'm doing 20 rounds of radiation for breast cancer, metastasized to several vertebrae in my spine. My left breast is greatly deformed due to the breast cancer, but I don't think I want to take a hormone blocker. Well, staying on the natural aromatase inhibitors like we have you on can be super helpful. Are they going to be enough? I don't know. The bottom line is a drug hormone blocker, you know, does work as far as blocking hormones. I mean, it shuts everything down. That's why people don't like them. So it's the bottom line is you got to trust your gut. You got to just pray about it and see what God's leading you to do. There's nothing wrong with trying, doing one thing at a time. So if you're doing the 20 rounds of radiation, then maybe you're going to say, hey, no, I'm not going to do the hormone blocker right now. I just don't feel comfortable about that. What's the negative about taking the hormone blocker? It's really the side effects. That's the negative. You just, you will, everything from every side effect that you'll have from blocking your hormones. Probably if most women would pipe in, maybe the hot flashes are the worst. I don't know, maybe for some women, it's not the hot flashes, it's the vaginal dryness, or it's the headaches, or it's the not having energy. I don't know, but some people kind of cruise through it and doesn't bother them as much. But same thing with men when they go on androgen deprivation therapy. Some guys tend to do okay with it. Not many. Most of them hate it. So it's just you got to weigh through those side effects. I'll be taking radiation treatments and chemotherapy for 7 weeks starting very soon. What precautions would I take around other people during that time? We touched on this a little bit last week. What do you do? The radiation is toxic. I think you're given a recommendations from the radiologist that you have to stay away from people for X amount of days. I never did radiation myself, and I don't remember what others have said that recommendation is. Depends on, I suppose, how much radiation you're getting. If it's just spot radiation on something, probably there's no precautions, but if it's a larger area, you're going to have a larger, what's called a rad dose, and that leaches, and it is a danger to other people. Now, rad dose has a half-life, and it will decrease over time. Would outdoor meetings mitigate the risk? I don't know. Anything any type of pollution, whether it's radiation or something else, dilution is the solution. So you think if you're outdoor and it can dissipate in a greater space, it would be better. I would still follow the radiations and radiologist advice, then maybe double it or triple it. If he's saying, oh, you're fine in 2 days, maybe make it a week or so or more. I would think of taking the glutathione, the radiation drops, any other detoxification, like we mentioned, binders in the gut, supporting your liver detox through coffee enemas, using saunas, all those kind of things that are going to help get that out of your body. Is ghee safe to eat? Yes, generally, yes. Now remember, even if I have you on a dairy-free diet, this is the question that we often get. What about butter? Well, butter is dairy, obviously, but if you're just using butter very, lightly, and you're not using a lot of it on a daily basis, butter is far better for you than any of the plant-based margarine type things. So you got to kind of weigh that out. What are your thoughts on glutathione? We already discussed that, I guess. Zeolite is a binder chelator /chelator, and that's a great product too. So I love zeolite and love glutathione. So I just started reading How to Starve Your Cancer by Jane McClelland. Are you familiar with this book? What do you think of it? So this is using what has come to become known as care oncology approach, which is using different medication to help block the metabolic pathways of the cancer, using doxycycline and metformin and things like that. They can have benefits. We have some people that might be on this call that are doing some of those things. the negative is that they're drugs and they have side effects too. So you have to weigh that out and feel what you're comfortable with. The tumors in my neck are HPV positive. In the last week or two, I've developed 2 warts on my finger on the same side of the neck's tumors. So I think that's a different virus. I don't think that's related. Does this mean that the HPV virus is still active in my system? Does not mean that. Though the HPV virus, like most viruses, often stay latent in your body no matter what you do. So that you have Epstein-Barr, HPV, other viruses in your body is, fairly ubiquitous. The warts are a different type of virus. One thing about warts, if you guys know, often warts are a sign of zinc deficiency. So look and see if you're getting enough zinc in your body. Zinc is really important for cancer patients as well. So zinc and selenium are good for breast cancer and prostate cancer. Zinc is good for all cancers. I've been taking your radiation homeopath for 2 days, as I have a PET scan, CT scan scheduled for tomorrow. Do I need to take precautions around people after these scans? No, you don't. There's not enough radiation that's going to leach really to other people. I don't believe. I mean, some people might argue with that. Anybody could be hypersensitive to different radiation and may have an issue with it. But for the most part, you don't need to be worried about that. How long do you need to take the homeopath? Finish out the bottle of the homeopath. Audio available for the master classes? Yep, I answered that. It's on the master classes now. I was reading that glutathione will be used by cancer cells anytime used. Yeah, well, cancer cells are going to use. I don't think glutathione isn't a fuel source. Glutathione is an antioxidant, so glutathione will be used by cancer cells if you're trying to poison them with an oxidizing agent, which is chemotherapy. So you shouldn't take glutathione if you're using chemotherapy. Do you believe that spike proteins from the vaccines shed to other people? Absolutely, I do. If yes, how do we protect ourselves and our loved ones? So quite honestly, this is the okay. So let's take a step back in history. How we started practicing and seeing cancer patients. Won't go too far back. Let's just go back 5 years. 5 years ago, we always had a distance program, which almost everybody on this call started on our distance program. Looking if anybody, maybe 1 or 2 of you came to our office. And you started on our in-office program, and then everything was distance. We had 2 days in the office. So the option was you could come spend 2 days in the office where we do get you started on a kickstart with detox. We have a bunch of equipment that we used. We did thermography. We did a bunch of stuff. We did in-office testing. Then you went home with your wife and you started that way. But a lot of people, even at that time, did the distance plan. And we probably had about 70% of the people did the in-office and 30% of the people did distance. And we had found over years of doing that really we had just as good a success with distance as we had with people coming to the office. But there was benefits of people coming to the office, we always thought, because we developed a close relationship with them. We got to see them for like 8 hours for 2 days, and they'd stay overnight at a hotel, and it was a great experience because we loved to develop those relationships. Then COVID hit, right? And basically shut down tons of clinics. We just refused to shut down. And I refused to wear a mask. So we're not going to play that game. And, I already knew the studies on masks. They're not going to decrease the transmission of a virus. They're not going to decrease, they're just going to make you sick. Hopefully none of you guys are wearing a mask. And we've had this discussion 50 times on the Zoom calls back when COVID was active, but they just are a harbor space for bacteria and an increased chance of you developing pneumonia and other issues that certainly a cancer patient doesn't need to deal with, because it's one of the top causes of death by cancer is pneumonia. So for cancer patients, so we don't want people wearing masks. We didn't want people to have to travel, but by their own desires, because of issues in everybody's state, our practice literally flip-flopped overnight. 30% of the people were coming in, actually less than that, maybe 10 to 20% of the people were coming in to do the 2 days in the office, and then the rest of the people were choosing the distance program. Well, then once the vaccine came out, we had patients, and some of you might be on this call, that got the vaccine. I'm totally 100% against the vaccine. But I'm not going to go into a huge discussion about that. Everybody had to make their own choice about that. But shedding from the vaccine was making me sick. So understand, I have my own cancer journey that I've been going on, and I would just get sick after somebody came in that was vaccinated. Sometimes it wasn't the patient, it was the spouse of the patient, or he or she had to get vaccinated for their job or whatever reason is their reason, but I would get sick, and it's like, gosh, there's just no, what is going on with this? I contributed to the shedding, and it was an issue for me, and I just said, that's it, we're done. I'm not going to die from the shedding of the vaccine, because we are stuck in a model that we don't need to be stuck in. We have just as good a success with people doing the distance plan. And we're sad about it because we don't get to develop that same relationship with people, but I'm still alive. So I guess I'm not too sad about it. So that's how we switched to that. Now we came out with a product when this whole thing came through, that's called Clear CV. So Clear CV was a product for the coronavirus. So that was for the coronavirus. And then we recommended for shedding, we always recommended lumbrokinase, nattokinase, and some other binders. Well, then now just recently, we have a new private label product that's specifically formulated to help with the spike proteins, and it's called ClearTox. So ClearTox has lumbrokinase. So instead of having to buy the US enzymes, lumbrokinase, and the natto, instead of buying 4 supplements, it's all in one supplement called ClearTox. So that's got the binders, it's got the enzymes, the lumbrokinase and the nattokinase, that's specifically meant to pull the spike proteins as best as we know how to do so at the current time. And that's a good thing to take. Now, I still personally avoid any close contact with people that I know are vaccinated. I do know that the spike proteins wane over time. So if it's been time that I have not gotten sick from any spike proteins, I don't think, for a long time. I do think that most people are not continuing to, anybody I see or hang out with is continuing to get vaccinated. They did it once or twice, and then because they had to, and then they're away from that. I did share a story last week because a friend of mine is a medical doctor, and he just got a job at Mayo in December, and they forced him to get the vaccine, or they wouldn't allow him to start. And he said his life just took a giant downturn. He said 100% difference. Well, he just bought one of our home PEMF devices. He's got a Rife at home, and he's using the PEMF device, and he said it really, really helps him. It made a world of difference for him. Did the H. pylori on my right. I did the H. pylori program on my right 3 or 4 days ago. The last 2 days I had 2 3-inch looking worms, one on Tuesday and one on Wednesday that came out in my stool. So understand that's not H. pylori. So the frequencies for H. pylori may have killed the worms if they are worms, and I'm not doubting that, but H. pylori is not a worm. So I looked it up and it appears to be a ropeworm. Okay, I should finish reading this, I guess. I was very lethargic both of these days, not feeling good. Just wanted to sleep, excuse me. No energy. Today I feel good again. Could it be from the H. pylori treatment? Yes, it could. Remember, these are frequencies. So just because a frequency has been shown to help with H. pylori doesn't mean that it won't help with other parasites. So that's very good news. I would do it again. Give yourself some time to recover and do it again. How do you treat candida? So any type of yeast infections has to do with an imbalance of your microbiota. Now we have different nutrients that people take. It really depends on how chronic this yeast infection is, how stubborn this yeast infection is. Definitely running some of the candida programs on the rife is important. And then if you don't want to start taking another supplement. So I used to have a candida program that was very effective. It is trying to get good probiotics into every orifice of your body. So one of the ways that you could increase the efficacy of a probiotic supplement is to put it in a culture. So let's think. So yogurt. So let's say you just bought some yogurt. Doesn't have to be dairy yogurt. It could be coconut yogurt. Try to stay away from dairy. So you can use coconut yogurt. Just get a plain coconut yogurt if you can find it, or an almond milk yogurt or something like that. That's your culture starter base. Then you can take a capsule of some different probiotics, and it's good to mix up your probiotics and then put a capsule of that in the yogurt, mix it up, set it on the counter, let it warm so the culture can grow the probiotic in there. It will typically liquefy the yogurt. It'll make it much more runny. Then if you have like an old saline enema thing, you can squirt it up in there. If you have some sort of way to like a little what do you call it, like a little plunger thing that you can draw up a syringe that you can draw up that liquid, and then you want to put that in your orifices. Where you'd put that in your enema, you would put it up your vaginal tract for a female, and you do this in the shower. You'll want to take some of that and swish it in your mouth and let it kind of dry in your mouth a little bit. It won't dry, but you let it coat your mouth. You want to get that probiotic. If you're just swallowing a probiotic to help with a candida infection, a lot of it is dying with your stomach acid, and what is surviving is just going in your intestinal tract anyhow. You have to get it in all your orifices. Even putting it on your hands and letting it dry on your hands and then rinse off, and do this on a regular basis. Those are some of the techniques that you can use for candida. I'm having more discomfort, pain from the tumors. Can you recommend something to help naturally? Any of the anti-inflammatory things. So the anti-inflammatory things are the flavonoids, the curcumin, the boswellia, the betalain from beets, which the only product that has the pure betalain from the beets is the aloe vera product. And then the white willow bark, the So things that are in our Clear Inflam product. So the anti-inflammatory things are what you want to do. Those are the things that will naturally decrease the pain. You can also think of arnica. You can get arnica as an herb, or you can get arnica as a homeopath. Those are things that some people really respond really well to arnica. Also think of CBD. CBD can be helpful. And if it's legal in your state, THC gummies can be super helpful. It can really help you sleep. The only negative of that, it can make you a little bit loopy, and some people don't like that, but take it before bed. It can give you a good night's sleep. That could be one of your best bets. I was told to limit eggs. What if I bought eggs that are corn-free, soy-free? Is that different? No. So there's no difference in that. It's still going to have the egg protein in it. My cancer markers have slightly come down. The tumors in my left breast are smaller, but the tumors in my right breast seem larger. The right breast has a tumor wound and had a biopsy. What are your thoughts? Tumor wound, sorry, and had a biopsy. What are your thoughts? Well, I don't know. The tumor, the right breast might be more inflamed right now, so that might not be a bad thing that it seems larger. It might be because your immune system really needs to address that and kill that, and it's really because of the inflammation caused from an immune response. I don't know that for certain, but I would go with that thought. And if you had a biopsy there and you have a tumor wound, well, then you're going to have scar tissue that's never going to go away, and it doesn't need to go away either. So I wouldn't necessarily worry about that. Scar tissue is just fibrotic and it's not cancerous. Is it safe to try taking mistletoe tincture? Yes, it is. But I don't think it's as effective at all, even close to even in the same book as mistletoe injection or IV. When I was going through menopause and started having hot flashes, I started taking a homeopathic remedy that made my hot flashes go away completely. Could this have thrown my hormones out of natural process and caused a pancreatic cyst? If you would have said, could this have thrown my hormones out of the natural process and caused my ER positive breast cancer, I would have said, yeah, maybe. Homeopathic is powerful. Homeopaths are powerful. But to cause a pancreatic cyst, no, I don't think so. No, because I don't think that is estrogen receptor positive. I don't think that has, I don't think that has anything to do with the hormone, would have anything to do with the hormone imbalance. So I would say no on that, but that's just my guess. How much zinc should I be taking? So, and how do you like to receive test results from other practitioners? So test results can just be sent to labs@connersclinic.com or info@connersclinic.com, and they'll go in your file. If you want to talk about them, then you just call and make an appointment. How much zinc should I be taking? As a general rule, 50 milligrams of zinc every day is what you want. Now, on all of you guys, so just so you know, because maybe some of the new people don't know this, when you've sent in like, oh, I'm taking this supplement, some of the reasons why I've said stop taking this supplement, it's not one of ours because ours don't have this in there, at least nothing that I would recommend, is because it has copper in it. So copper and zinc are like antagonists in your body. You need both, don't get me wrong, but you have this copper zinc balance. Copper stimulates growth. Zinc doesn't have anything to do with growth, but they're a mineral complex imbalance. Most people with cancer have an excess amount of copper to zinc, so their copper zinc ratio is off. Not horribly off, but it's off. And there's been a lot of assessment and some studies on this, your copper zinc zinc to copper ratio. And that's why I don't think a cancer patient should be taking exogenous copper. You'll get copper in your food, plenty enough for your body to stay alive and not have a copper deficiency. But we can get too much copper. People have copper kettles, they have copper pipes in their house, they have copper sources, and people, this whole fad about wearing copper jewelry for this or that or something like that. Excess copper, that's all bad for you. Copper on top of that, it's all elemental copper, which is even worse, throws off our zinc balance, and that can lead to at least a piece of the cancer puzzle. So that's why I've taken everybody off of copper. And just going off copper usually brings the zinc balance back into place. But should people take more zinc? Well, anybody's taking any of our minerals, you are taking more zinc, and our minerals don't have copper in it. So, but how much how much zinc should you take? It depends on what you're trying to do. Let's say if somebody called me and said, hey, I have warts, I just want to get rid of my warts, I'd say take 50 milligrams of zinc a day for a week, and then off a week, then on a week, and off a week. It kind of is good to cycle that like that for warts. But typically 15 milligrams of zinc is fine, but 50 milligrams of zinc is taking just more zinc. You can't really overdose. I can't overdose on anything, I guess, but you're not going to really overdose on zinc. I'm scheduled for a CT and MRI back June 15th. Both will be with contrast. So far, I have tolerated contrast with no issues, but concerned on impact to liver. I do plan to do homeopathic treatment for MRI. Thoughts on doing this back to back? We've had a lot of people do it back to back with no issues. I would just do everything we talked about earlier about doing everything to support your liver. So you get your liver cleaned out as much as possible, you'll be able to cruise through that and flush that garbage out. I will do an MRI at the end of the month. Can I start using the homeopathic droppers now? Yeah, I mean, you could take homeopathic radiation droppers. There's no sense. Well, let's take that back. There's really no sense in taking the gadolinium droppers. If this was, you're doing a CT scan at the end of the month and you want to take the radiation droppers, we're all exposed to radiation on a daily basis. So yeah, it would be good to take the radiation homeopath. But you're not exposed to gadolinium on a regular basis. So I would wait until, a couple days before your MRI to start taking it. I lost a healthy amount of weight after we started our program, but my stomach is still a bit bloated at times. I do a coffee enema every day. Nobody who has ever muscle tested me has told me I need digestive enzymes. Any ideas? I don't want to overlook any areas of detoxification. Well, I think that I don't think anybody could be hurt by taking digestive enzymes. I mean, your body's making digestive enzymes. So I would, if you feel bloated, you should be taking digestive enzymes. And I'll tell you, they don't always come up on muscle testing. There's a certain kinesiology test for HCl. There's not a specific kinesiology test for digestive enzymes, so I would go ahead and take them. It was number one thing in Goodhart's book was HCl and digestive enzymes. That was the number one thing. He thought everybody should be on them. Did you know Dr. Buttar? I had met him once and talked to him on the phone. Another time he was going to be on my podcast. It just never happened because it was right before COVID hit, and then he got into whole sorts of things during COVID because he was very outspoken and they just battered him. So we never ended up getting a podcast schedule. Should I run a general parasite in rife or just do the H. pylori again? Well, the H. pylori obviously did work, so I would do that again. Do you have any suggestions for rife programs for detoxing after the PET scan? No, I would just do your foot bath programs. Is it best to go through menopause without taking anything at all? Just let it do its course. No. If so, when you go through menopause, your ovaries shut down, and gradually you produce less and less progesterone and estrogen. Now, women that go through menopause and go, yeah, I didn't really have any menopause symptoms. I was glad I didn't have to have my period anymore, blah, blah, blah. And I didn't, I kind of sailed through it. They have really healthy adrenal glands. So your adrenal glands do make some estrogen and progesterone. And they're supposed to kind of make up the difference, not at all the same amount, but they will make up the difference. So you kind of go through menopause in a nice gradual way as your ovaries start to degenerate. People that have serious problems with menopause, we're not talking about people on estrogen lowering medication, we're talking about just menopause. When your ovaries are shutting down and they have serious hot flashes and symptoms, you really want to support the adrenal glands. So, especially if you have a history of breast cancer, you don't want to go and give soy isoflavonoid, like we talked about with Genistin or something like that. If you have a history of breast cancer, if you don't have any history of cancer, that's what I would use. But if you do have a history of cancer, I would only use adaptogens. So you do things that will support adrenal function, but you might not need to. So let's say, you particularly are on a lot of supplements, not saying you need to do that, but supporting adrenal function is what you would do if you had symptoms. Is Cleartox a good remedy for people who have had the vaccine? Yes. So it's for people who have had the vaccine and for people who are exposed to people who have had the vaccine. Is Cleartox good for mold? No, not really. No. That's a whole other discussion. Not it's not for clearing out mycotoxins. Is it good to ask for MRIs and CTs without contrast? No, because you can, but you can't see the same things. So I was told that the heavy metal in the gadolinium stays in the brain. It can build up. Where people really have problems, some people have a sensitivity to it and they can have a reaction and get really sick. But if you've had it before and you don't have that, the chance of that happening is pretty small. It's a very small percent of the population that have that type of reaction. So again, you go back to my bottom line of this is you only do these invasive tests if it's going to change the way you treat. So you don't do an invasive test like MRI with gadolinium or CT scan, which is just by itself without contrast, there's a lot of radiation. You don't do that if you're just trying to satisfy curiosity. So you only do it if it's going to change the way you're going to treat it. And of course, for the medical doctor standpoint, they're like, yes, it's going to change the way I treat it, because if this is positive and we see changes, then we're going to up this dose or change this dose. I get it. But if the patient's like, well, I ain't going to let you do that anyhow, well, then don't do it. So you're ultimately the person that has to deal with all these things. They go home, to their families at the end of the day. You got to deal with the garbage that happens afterwards. So you have to weigh those things out. Okay, well, I'm not going to do any more of that anyhow. I'm not going to get that MRI or CT scan. Because even the CT scan without contrast is tons of radiation. It's like 50 chest x-rays. So, but if you can't do the toxins, then if you can't do the deal with the toxins and know that gadolinium builds up in your system, then that is an issue. So I'd weigh those things out. Can kids take Cleartox? Yeah, kids can take pretty much any supplement, but you just dose it via body weight. So if it's a small child and you just got to, okay, the clear tox, typically if you're an adult, 150 to 250 pounds, you might take 2 to 4 to 6 a day, depending on if you had to get vaccinated or you're exposed on a daily basis to people that are vaccinated, or you're exposed to somebody freshly vaccinated, you're going to take more. Take less if the person was vaccinated. That I work with this person and they were vaccinated a year ago, but they haven't been since. There's probably not a whole lot of danger that sloughing anything from them at this time. But you just dose it, you know, just think of their body weight and how you would dose it out. So US enzymes is good to start. Is there HCl in that? Or are you talking about the enzymes? So the HCl zyme is if you have that, the HCl zyme, that's how it's spelled, like that, is the US enzymes, HCl plus digestive enzymes. Our private label clear, what is it called? Clear Digest, I think it's called, is Designs for Health digestimes. And I actually like that one better because it's got a better mix of enzymes. And actually, I think they source the enzymes from US enzymes, so they're the same thing. But I think it's a better blend for somebody just for digestive purposes. So if it's just like, oh, just for my stomach to help me digest, I'm getting bloated, I would do the Clear Digest. Plus, it's a better value. You get a lot more in the bottle, and it's a little bit less price. Digest Gold is also good. I'm not familiar with that one. But I would, if you have, especially have bloating, I would get one with HCl in it. And remember, if you get a digestive enzyme with HCl in it, you only take it when you eat. So you don't take it on an empty stomach. So you're only taking it when you eat. So like my wife carries some in her purse in a little baggie. So if we eat out, we take one when we eat. And you get to a point where oh, I need to take a couple when I eat this type of food. When I eat meat, I have to take a couple, 3 of them, or I'm going to eat, something else, then I don't have to take anything. You'll kind of get to know that. And how you dose it is you kind of titrate up as well. One helped a little bit. Now, next time I'm going to take 2. Well, that helps a little bit more than 3. Oh, that really helped. You still don't have to take 3 every time you eat. You might have to do that for a week and then titrate back down to 2, down to 1 again. So you're really trying to take pressure when taking digestive enzyme with HCl. You're taking pressure off your stomach's production of HCl, and you're taking pressure off your pancreas's production of digestive enzymes. Yesterday at the oncologist, my temperature was 100.4. I just took it again, and it's 100.4. I asked you to get a CBC. So you probably did that. When you get the results, if you could send that to me. Of course, when you have an elevated temperature, you think that there could be a infection, right? So having night sweats, but not daytime hot flashes. Yeah, well, night sweats are tied to cancer itself. Hot flashes are tied to a sudden, strong down fluctuation of estrogen. And the night sweats that are tied to cancer, they don't really know why it happens for some people and it doesn't for other people. They think it's a fluctuation in hormones. they just, there's a lot of theories on why. I'm just really interested to see what a CBC looks like for you, because we want to look at that white blood cell count. Okay, everybody, thanks for being on tonight. Know that I'm praying for you guys. I love you guys, and just keep up the good fight. If you need to call, make an appointment to talk to me personally, you certainly can. But know that whether we ever see each other personally, hopefully we'll see each other all in eternity. And that's my ultimate desire for you guys, and my ultimate prayer for everybody. Know I'll be praying for you. Love you all. Bye-bye.